I have been a specialist trainee for 2 years. I currently work on surgical ICU, which take care of some of the sickest people in the hospital, patients that need constant monitoring. Sometimes I work 13-hour shifts, and I'm lucky if I have time to heat up my lunch. It's super stressful. I got home after a long shift at work, and was welcomed by a letter. It looked important, and I opened it right away. It was a registered letter from the medical council informing me that the family of a deceased patient had made a formal complaint to the hospital, implying that there was evidence of poor communication. If found to be culpable, I was at the risk of losing my ability to practice. The letter said that I had a certain amount of time to respond to the allegations. I immediately called medical protection, and I was put in touch with a lawyer who created a plan of action and ran me through what to expect from a typical formal complaint process. I provided them with all of the patient's notes I had written, which would help them to formulate a timeline of events and aid in drafting up a letter of explanation to the medical council. They acted pretty quickly, and I think we sent a letter back to them within a few weeks or so. All I could do was wait. That was the hardest bit because I just couldn't switch off the negative thoughts. It had a huge impact on my mental health and my ability to focus at work. It completely knocked my confidence. 6 years of training, all for nothing. Medical protection suggested that I attended some workshops in patient safety and communication. The thought was that I could show the medical council that I was actively looking to make changes to my work practices, which could help me if the matter escalated into a formal inquiry. When the reply letter from the medical council finally arrived, I had to sit down to open the letter. I feared the worst, but to my relief, they had accepted my letter of explanation. As soon as I read those words, I just started to cry. All of the pressure was released in that moment. The investigation was still ongoing, and some of my colleagues had to attend a further inquiry. I was just so thankful that my involvement had come to an end, but I felt sad for my colleagues. I remember in that moment thinking how glad I was to have full regulatory protection with medical protection, because I really believe that's what made the difference.